Dr. Marie Roseline Belizaire is an emergency director with WHO Africa and a specialist in epidemiology, public health and infectious disease outbreaks. She joins us from Geneva. Thank you so much for your time, Doctor. Can you tell us, Rwanda has closed its border. How worried are you about undetected spread, that this is far worse than the numbers we are seeing at the moment?
Effectively, in WHO, we are very concerned about the ongoing Ebola outbreak actually declared in the Ituri province. We are concerned for several reasons. The first one is that you mentioned the Ituri province share international borders with Uganda and South Sudan. I'm sure you already know that Uganda notified 2 confirmed cases of Ebola linked to the outbreak in Ituri. But Ituri province also share borders internally. And one of them is the North Kivu with the capital of Goma. And in North Kivu, as you know, the population is about 9 to 10 million of inhabitants. And they also share border with South Kivu, which population is 8 to 8.5 million inhabitants. That means this is one of the concerns. The other concern we also have is that Ituri province is plagued with militias, with rebels. Not on, 3 weeks ago from April, last day of April to starting May, we have 180 civilians that has been killed in this province. And from January to now, more than 879 civilians have been killed. So we also have an internal displaced population based on this insecurity that is ongoing. In Ituri province, we have more than 1.5 million people living in a very difficult and vulnerable condition as internal displaced population. Other factor that justify our concern is the movement, the population movement between through the international borders, but also internally. The Ituri province is very connected with Uganda. Mostly people in Ituri, they go to seek for health care in Uganda. This is a common, and they have all activities together. The population movement is very high, and the density of the population also is high. Other concern that we also have, this zone is we have a lot of mines. That is also a very high trade activities in this region. So all those make this outbreak very concerning. As you know, the outbreak has been detected weeks after it started. That's said in community we have a death that we don't know for what they happen. So the extent of this outbreak can be bigger for the picture that we have now.
Yeah, and you said, thank you for, there's a very comprehensive explanation. And so my understanding is then that there are so many different complicating factors that affect how you will respond to this on the ground. But the other side of the equation has to be getting help there. And we know that the United States has fully withdrawn from the World Health Organization. With it goes billions and billions of dollars. So I'm wondering what impact you think that will have on health organizations' ability to respond to this outbreak.
So the work at the ground is already started. You know, our team was already in the ground since they received the alert. Since on 9th of May, we have a team in the ground who support the sample collection and the sample transportation to Kinshasa in order to have the confirmation of that outbreak. The first samples came negative. That was also another challenge from the laboratory in Bunia. So that's added a lot of layer of delay in that outbreak. So far, how we organize the response, we are working with the government in a response that is led by the government, but also with the community. The basic things that we need to know is that any outbreak starts in a community and will be ended in the community. If we put in place some measure involving the community on how to protect themselves, we can control that outbreak. We're also working with partners. You know, there is no single organization that can respond alone to this outbreak or to any other emergencies. So we are really coordinating with all our partners in the UN system. We have a one UN response that is already ongoing. This morning, with the WFP plan, we will land to Bunia for the first first, 18 tons of material for the response that will be delivered in order to kick off. So we really have a
Dr. Marie, I'm so sorry to interrupt. I just want to ask you, with the time that I have left, just one final quick question. It's very reassuring that you have so many opportunities to put plans in place to tackle this from the beginning. I'm just wondering, though, you are there next week. Is there anything in particular that you are concerned about what you will find when you arrive?
My first concern is the trust in the community. Because, this community has been affected before by an Ebola, and for which there is a vaccine. Now it's important that we inform that community that for this subtype of Ebola, there is no vaccine. It is one of my concerns that the community can lose trust in us, can lose trust in the government. So it is very concerning for us, and the reason why we are working since the start in order to involve the community in this response. I'm also concerning of the number of cases I would be finding in the ground, because as I mentioned, we discover this outbreak with some delay. So the outbreak can be extended maybe to April or to April for sure, so we need now to conduct that retroactive case searching, and I'm afraid that the result I could find in the ground can be really scary.
All right, Dr. Marie Roseline Belizaire joining us from Geneva. Thank you so much and safe travels.